Welcome to The Explainer. Okay, I am so incredibly excited to get into this one because today we are talking about literally the most amazing, complex piece of machinery you will ever own, your own body. Seriously, think of your body kind of like the dashboard in a highly advanced car. You know the one? It's got all these sensors, dials, and little indicator lights running in the background, constantly monitoring your internal systems. And, most of the time, everything's totally green and running smoothly. But occasionally, a little warning light starts flashing. And no, you can't just slap a piece of black electrical tape over it and ignore it like you might do in your car. The real question is, are you actually paying attention to it? Well, today, we're going to decode that dashboard. We'll be looking at 10 vital signs your body uses to tell you something might be off, what those signs actually mean, and exactly when you should stop hitting the snooze button on them. So let's dive right in. Your body is constantly communicating with you. It is just so true. Now, let's be real for a second. Everyday aches and pains, they just happen. You get a headache after a ridiculously long day of staring at a computer screen? Completely normal. A little stomach ache because you ate way too much at dinner? Yeah, we've all been there. But there is a massive difference between a temporary, harmless little whisper and a persistent, ringing alarm bell. Persistence is the absolute key here. It's really about knowing when to listen, when it's safe to just shrug it off, and when you need to realize your body is actively asking for your help.
But here's the kicker. The real problem is that most of us are just terrible listeners when it comes to our own biology. We brush things off, we blame it on stress, or we just grit our teeth and push through. Well, I want you to shift your mindset today. I want you to think of yourself as a detective, actively learning to read your own physical clues. Now, to be perfectly clear, right out of the gate, noticing a symptom absolutely does not mean you are facing immediate doom. A symptom doesn't automatically mean you have some serious disease. But these clues are signals, and they're meant to guide you to figure out what's actually going on early.
To help us decode all these signals, we're going to break today's explainer down into 5 simple steps: systemic shifts, surface and output clues, acute alarms and pain, decoding your baseline, and finally, when to seek urgent help.
All right, part 1, systemic shifts, the whole body whispers.
So there's a really clear contrast between what's perfectly normal and what's a systemic warning. Look, if you've had an absolutely crazy week at work or your sleep was terrible, feeling exhausted is just standard human biology, right? Same thing goes for your weight. It naturally bounces up and down based on hormones, hydration, or maybe what you ate over the weekend. But if you are waking up constantly exhausted despite getting plenty of sleep, and you've just totally shifted from your normal energy levels, well, that's a warning. Persistent fatigue can be tied to a whole bunch of things, from thyroid problems and anemia to nutritional deficiencies. And as for weight, if you're experiencing unintentional, completely unexplained weight loss or gain, and you haven't changed your diet or activity habits at all, your body is begging you to investigate. The absolute magic word here is unexplained.
Now, 2 more major systemic clues revolve around your hydration and your blood sugar. If you just crushed a hard workout or it's a 90-degree summer day, obviously you're going to be thirsty. That's a given. But if you have this persistent, excessive thirst, especially when it's combined with frequent urination, you really shouldn't dismiss that. It can be a massive clue for problems with blood glucose regulation, like diabetes. And next, let's talk about the brain. Because yes, your brain is part of your body and it sends warnings too. We all have days where we're a little distracted or forgetful, but significant ongoing changes in your concentration, memory, or your mood, that's different. While it could just be stress or poor sleep, persistent mental shifts can indicate underlying medical conditions that absolutely need professional evaluation.
Moving right along to part 2, surface and output clues, visual diagnostics. Digestion is a huge part of this puzzle. The crucial point is separating the temporary whispers from the loud alarms. Getting a bit bloated after you eat a massive meal? Honestly, that is usually not a big deal. Occasional constipation or diarrhea happens to literally everyone. However, persistent digestive problems are a whole different ballgame. If you're dealing with ongoing abdominal pain, repeated chronic diarrhea or constipation, persistent nausea, or especially blood in your stool, you absolutely cannot ignore that. If your digestion is totally broken away from your normal pattern and is just consistently different, please don't just learn to live with it in discomfort. Talk to a professional.
Let's rapidly run through 3 more visual clues. First up, skin changes. What you're looking for here are new rashes, changes in pigmentation, or wounds that just simply aren't healing normally. Second, changes in urine. You might not think about it much, but dark urine from not drinking enough water is one thing, persistent blood in your urine, pain, or major shifts in your habits are another. Even if you only see blood once and it doesn't hurt at all, get it checked. Finally, unusual swelling.
If you have new, persistent, or completely unexplained puffiness in your ankles, your hands, feet, or your face, it could be a clue for kidney, liver, or cardiovascular issues. Once again, the absolute critical word across all three of these is unexplained.
Actually, I want to pause for just a second and isolate one specific, super important warning sign on the skin. Your skin is the largest organ in your body, and very often it speaks to you way before any other symptom even appears. You need to pay extremely close attention to a changing mole. If you have a spot or a skin lesion that is actively evolving or just looks significantly different from your other moles, whether that's a change in its size, its shape, its color, or just its general appearance, that is a direct message from your body. It needs to be evaluated by a healthcare professional as soon as possible.
All right, part 3, acute alarms and pain, the sharp signals. Breathing is really our first sharp signal here. I mean, obviously, being out of breath after you go for a run or maybe after climbing a few extra flights of stairs is completely normal. It mostly just reflects your current fitness level. But if everyday activities, like just walking around your house or doing basic chores, suddenly leave you unexpectedly breathless, or if that shortness of breath is getting progressively worse over time, that is a sharp alarm. It could point to respiratory conditions, anemia, or even cardiovascular problems. Okay, let's talk about headaches. Headaches are incredibly common. Most of the time, they're triggered by super basic things like stress, a lack of sleep, dehydration, or, staring at your phone for way too long. The goal here is absolutely not to be terrified every single time your head hurts. The goal is to recognize a change in the pattern. If your headaches suddenly become way more frequent, if they are significantly more severe than usual, or if they just feel entirely different from any headache you've ever had before, that is your body telling you something has changed.
Which brings us to part 4, decoding your baseline, the biggest lesson.
Everybody take a deep breath and really try to remember this. Symptoms are signals. They are not diagnoses. Just having one of the symptoms we just talked about does not mean something is permanently or seriously wrong with you. Fatigue doesn't automatically mean you have anemia. A headache doesn't automatically mean you have a brain disorder. Thirst isn't always diabetes. These are just signals. It's just your body waving a little flag saying, hey, over here, look at this.
So how do we actually turn this into a usable strategy? Well, next time you feel something off, just run through these 4 questions. 1. Is the symptom new? 2. Is it persistent? Meaning, is it sticking around instead of just fading away like it normally would? 3. Is it getting progressively worse? And 4, honestly the most important one, is it unusual for you? This is what we call your personal baseline. What is totally normal for someone else might not be normal for you at all. Knowing your own baseline is literally your absolute best defense.
And that leads us right to the golden rule of decoding your baseline. You know your body better than absolutely anyone else on the planet. You are the only one who can truly feel when that baseline shifts. But, and this is a massive but, you shouldn't try to diagnose it yourself. Noticing the change, that's your job. Figuring out exactly what is causing it through exams, blood tests, or imaging, that is the doctor's job. Please don't fall into the trap of self-diagnosing on the internet. Let a professional actually look at the signals.
Finally, part 5, when to seek urgent help. The emergency overrides.
Okay, let's be super clear. These are non-negotiable red flags that require an immediate professional assessment. If you or someone you're with experiences severe or sudden difficulty breathing, or severe chest pain and pressure, if there's sudden confusion or a loss of consciousness, if you feel sudden weakness or numbness, particularly on just one side of the face or body, sudden difficulty speaking or understanding speech, a sudden extremely severe headache, which is often described as literally the worst of your life, severe allergic reactions where breathing becomes difficult, or heavy bleeding. These symptoms entirely bypass the whole wait-and-see approach. These are emergencies. Seek urgent medical attention immediately.
So, as we wrap up today's explainer, I really want to leave you with one final thought. Your body is whispering to you. Right now, it is constantly working behind the scenes to keep you safe, and sometimes it just gives you a little nudge when things aren't quite right. The goal of all this isn't to make you paranoid about every tiny ache or pain. It's to empower you. Paying attention to your health doesn't mean you're always expecting the worst. It means you are giving yourself the ultimate gift, the chance to catch problems early, or sometimes just getting the wonderful reassurance that everything is perfectly fine. So what is your body trying to tell you today? Thank you so much for joining me to explore this incredible topic, and I'll catch you on the next explainer.